am I doing? I'm being a responsible community member. There's some upcoming changes in the Medicare drug plan and some open enrollment dates coming up, and I'm just doing my best to get the word out about it. You're relieved? Well, just what kind of drug plan did you think I was talking about? No, never mind. Don't even tell me. Look, come on inside with me. I've got somebody for you to meet. They not only understand about Medicare and the Medicare drug plan, but they've got the ability to help you and the people you know who have Medicare understand what they need to be doing to protect their prescription benefits. Come on. Hi there. I'm BevVan Phillips with Home Access Solutions. Now, you know that at Home Access, we don't have anything to do with pharmaceuticals, but we are often working with people who use Medicare as one of their medical funding sources. And we heard about some upcoming news that we think is very, very important to get out. And we're doing our part as a responsible community member. I want to introduce you to Nicole from Volunteers Assisting Seniors, because she is one of the experts who can help us better understand what we need to know about the upcoming enrollment period that involves Medicare drug plans.
Nice to meet you.
Yeah, Nicole. So why should seniors consider changing their Medicare drug plan?
Well, each year, Volunteers Assisting Seniors recommend that seniors review their drug plan. Throughout the year, the premiums on their drug plan may get ready to change as 2011 approaches, and a senior may change their medications, and we want to make sure that their current plan is still going to cover that.
That's good. Nothing ever stays the same, does it?
Right.
Okay. Well, how does a person determine if their plan is going to work for them in 2011?
Well, we recommend you come into our office, or you can use the Medicare website yourself and do what's called a drug comparison. You take your medications, you put it into the website, or we can put it into the website here at VAS, and look to see if your plan is still covering those medications. So we're going to make sure that the annual premium is one that you're comfortable paying, and that there aren't any quantity restrictions on your medications, any formulary restrictions, things that you would want to know about before choosing a plan.
That sounds good. And you mentioned some places where people can go for help.
Right. We have set up events throughout the Omaha area for seniors to come and have their review done by one of our trained volunteers.
That's good, because as a health professional, even one who doesn't work directly with Medicare-related services, I'm aware that sometimes that system, because it's so big and does so much, can be a little bit complex to navigate by yourself.
Absolutely. But for those of you who are comfortable using the computer, you can also use the Medicare website yourself by going to medicare.gov, putting in your information and looking and seeing what Medicare pulls up for you.
Okay.
And if anybody needs any help while on the computer, we can answer your questions over the phone.
Now, Nicole, one of the things that made me interested in trying to spread the news about these open enrollment for the Medicare drug plan was something I heard, that there are some changes, less drug plans available to people this year. I heard this at one of the presentations your volunteers made.
That's correct. In 2011, 15 plans are going to be eliminated.
Wow.
And the people who are on those plans currently would have received a letter back in October telling you that that plan is going to end. So we're going to want people to come into the office or get onto the Medicare website and look at what their new plan options are going to be.
Okay.
Because at the end of December, their plan will have ended, meaning they will have no coverage.
No coverage.
That's correct. That's correct.
That's scary.
Right. Medicare is going to give them a special enrollment period in January. So at the absolute latest, they must have a plan chosen by January 31st. And if they don't have anything chosen, they will be without coverage.
I do not know many people who could do without their prescription coverage.
Right. That will be a financial hardship for many.
So this is pretty serious. Okay. Is there any fee for coming in and talking with volunteers assisting seniors?
Absolutely not. Our services at VAS are free.
That's good news. So, share the news, share the video, be a responsible community member, and if you have Medicare or you know someone who has Medicare, remind them to open their mail that's coming in October, remind them to review their prescription drug plan because it's important.